Good day and welcome to this broadcast. My name is Shauna Munson and I'm a student at North Central University. Today I'm going to be discussing the resource guide and some of the included assessments that can be used when dealing with marriage and family therapy with military and veteran populations. Whenever a clinician is wanting to assess the needs of an incoming client, it is important that they are aware of available assessment tools to help determine the best course of action for that client. When dealing with active duty military, veterans, and their families, it is vital that barriers to communication, positive familial functioning, and individual needs are all assessed. While there are many resources available, it can be overwhelming to know which assessments may best fit the needs of that particular client present. Today, we're going to briefly discuss several assessments that will be available in my resource guide and that can be added to your toolkit to improve the quality of assessment when working with military-related populations to help identify the particular needs of that family and/or individual. PTSD is a current issue that is being explored and researched daily. While it's being explored, thousands of people are suffering from the symptoms of PTSD. This is especially true with combat veterans. While there are many assessments available for the diagnosis of PTSD, there are several: the Combat Exposure Scale, the Traumatic Checklist, the Mississippi Scale for Combat PTSD, and the Clinician-Administered PTSD Scale, or CAPS, that are used by the Department of Veteran Affairs as the primary diagnostic tools. The Combat Exposure Scale, PCL-5, Mississippi Scale for Combat-Related PTSD, and the CAPS assessments were all developed by the Department of Veteran Affairs National Center for PTSD, specifically to measure PTSD symptoms in combat veterans. The CAPS is considered the gold standard assessment in terms of PTSD diagnosing. It requires more training to administer than the remainder of the assessments, as it consists of a semi-structured interview and requires an experienced clinician to interpret the responses. The CAPS allows the clinician to make a current diagnosis of PTSD, as well as to make a lifetime diagnosis of PTSD. The main downfall of the CAPS is the inability to assess for complex PTSD, as it only focuses on one traumatic experience at a time that occurred during the respondent's lifetime. The Combat Exposure Scale, PCL-5, and the Mississippi Scales are easier and quicker to administer, as they can be administered as a self-report or as questions completed with the clinician. When assessing family members of veterans with PTSD, it is important to recognize and assess for the possibility of secondary traumatic stress, or STS. STS can be assessed for by utilizing the Psychological Distress Index, the Secondary Trauma Scale, and the Child Behavior Checklist. The Psychological Distress Index helps to measure the spouse's psychological functioning within the past year, and it should be noted that spouses who live with someone diagnosed with PTSD score higher on this assessment than spouses that do not live with someone diagnosed with PTSD. There is also a high correlation between higher scores and increased marital problems. The Secondary Trauma Scale is helpful in assessing family members for secondary traumatic symptoms due to prolonged exposure to someone diagnosed with PTSD. Finally, the Child Behavior Checklist helps to identify internalizing and externalizing behaviors that children experience as a result of living with someone with PTSD and other mental health disorders. In the 2016 research article, Secondary Traumatization in Vietnam Veteran Families, it was found that male children of parents diagnosed with PTSD exhibit higher levels of internalizing behaviors. Girls were found to exhibit both internalizing and externalizing behaviors associated with the degree of demoralization in the veteran's partner. Research has also found that individuals exhibiting higher scores for secondary traumatic stress have an increased risk of depression. As a result, it is important for the clinician to assess for depression and other mental health symptoms if a high score is present for secondary traumatic stress. Often, when there are identifiable mental health issues, there's also an increased chance of underlying substance abuse issues. After assessing for mental health issues, it is important to determine if any of the functional impairment in the family system is a result of alcohol or drug use. The Alcohol Use Identification Test, or audit, is a quick way to assess for possible alcohol-related dysfunction. The screening test comprises of 4 questions that can be asked to determine if additional questions are needed. When assessing family needs, it is also important to assess for relationship quality, domestic violence risk, and growth. Several assessments are available to assess for marital relationship satisfaction, including the Quality of Marriage Index, the Relationship Assessment Scale, and the Revised Dyadic Adjustment Scale. These assessment tools are beneficial in determining initial baseline scores, as well as progress over time in regards to relationship satisfaction. The HITS assessment can be used to identify possible domestic violence. The benefit of this short assessment tool is that it's 96% accurate at identifying abuse victims and is available in many languages. The last two items in this resource guide are the Family Empowerment Scale and the PTSD Growth Inventory. The Family Empowerment Scale assists clinicians in identifying support systems and helping families to help find new avenues to meet goals by identifying resources outside their initial thought patterns. The PTSD Growth Inventory allows clinicians to objectively identify areas of growth in veterans with PTSD and to help the veterans identify areas of growth for themselves. All of the assessments mentioned in this presentation are generally available online and are useful tools for any clinician to have in their toolbox to promote accurate, efficient, and clear diagnostic decisions and to provide an individual roadmap for treatment specific to the needs of that family or individual. I hope you have found this information as helpful as I have.